Welcome back, everyone. Winter has been a 6-month season, it seems, so that can have attacks on people's mental health. Katrina is here this morning to tell us how we can navigate that. Good morning, Katrina.
Good morning. Thanks for having me.
Oh, thanks for coming, of course. So what are some common mental disorders that people can identify during this time of year and with this environment?
Yes, so a very common one is seasonal affective disorder, so sometimes known as seasonal depression. And typically we see that happen in like the later fall, winter, and symptoms progress as the season goes on. And you can expect just typical depression symptoms.
Okay.
However, the light is a really big thing. We're not seeing that light, and so it's really hard for people to get out and do things that would be helpful for their depression. And so a really common one in the wintertime is that seasonal affective disorder.
Yeah, of course. And that's also, if you guys have seen the acronym, it's SAD.
Yes.
SAD, yep. So what technically is seasonal affective disorder?
Yes, so seasonal affective disorder is actually just major depressive disorder with a specifier of seasonal depression. And so in order to get that diagnosis, you need a previous diagnosis of depression. And the seasonal affectiveness needs to be happening for 2 consecutive seasons, the same season for 2 years. And then that is when perhaps a mental health provider or even a doctor would make that diagnosis.
Yeah, absolutely. So how common is it?
It is, it's common. I would say we all know that someone that struggles with depression, and then we know a lot of people that struggle with depression even every season. And so I would imagine that everyone has been impacted by it in some way.
Oh yeah, for sure. So depression and seasonal affective disorder, what are some of the symptoms that you can kind of identify?
Yes, absolutely. And so with that seasonal affective disorder, we notice that people are tired a lot more, right? They want to stay in bed. Sometimes we even notice weight gain. People typically crave carbs in the wintertime, right? We just have low motivation, a desire to not really engage in those tasks that we used to. So we're staying home, we're canceling plans, and then even we can be irritable or anxious as well.
Yeah, absolutely. And even though those are some like pretty common symptoms that people can relate to, when do you think it's the right time to go seek help?
Yes, so I always recommend, get in before it gets too severe, right? And so that is something that you can do either with a mental health professional, you can do things at home, or even your doctor. For say if your doctor wanted to put you on medication, typically they want to do that before the symptoms get too severe. And so if you know that you are someone that typically gets sad during the winter, I would recommend make that appointment early fall so that you and your therapist can start working on those skills before that first blizzard hits.
Yeah, absolutely. So with that, I know the first thing that you should do is go see a doctor. Is there anything else that you can do?
Yeah, so one thing that I recommend for people at home is there is something called light therapy. You can go online, you can get a light off of Amazon, and what this light helps do is it helps mimic the sunlight. And so what it can do is it can help make more less melatonin in the brain so that you are more awake during the day.
Yeah.
When it's dark outside, our body naturally produces more melatonin, which then makes us more tired. So using this light therapy as a supplement can really help to just kind of get your day started off right.
Yeah, and is that vitamin D?
Yes.
Do you think that the vitamins would help also?
Yes, absolutely.
Okay.
Vitamins, and then too, just making sure that you're allowing time to do those things that you like, socializing with people, getting out, having those virtual dates if you can't get out. Those are all so important things that you keep doing.
Yeah, absolutely. All right, so where can people find more information?
Yeah, so you can always go online. I am a mental health therapist at Solace Counseling. You can find us on our website, solacecounselingfargo.com. Or yeah, just go on Google, type in those things, and you should find us.
Yeah, perfect. All right, and then we do have your information up there right now. So just to kind of round out the interview here, we talked about the symptoms, and although they are, a lot of people can relate to them, what would a typical day with someone who's diagnosed with SAD, what would it look like?
Yeah, so I would say it starts right away in the morning. It's hard to get out of bed. You don't really have motivation to maybe go to work, and so you might even be canceling plans. You might not be wanting to eat, or you're just sleeping all day long. So it can really start in the morning and can get our morning off not on a good start, right?
Yeah.
And then it just kind of progresses throughout the day. And so people kind of see symptoms happen all night long.
Yeah, absolutely. All right, well, thank you so much for coming in and telling us about that. Yeah, very important topic. All right, well, we have lots more coming up on today's show. We're going to get the details of a fundraiser at Sicky's Garage.